Hello, my name is Dr. Tom Whalen. I'm a family practice doctor. I am 51 years old. I've been doing this for about 22 years. I came out of med school and residency and never felt like the smartest doctor in the world, but with experience you get a unique perspective. My experience with practicing medicine is that many doctors do it wrong. We tend to think, here's the problem, here's the pill, and I think this is to the detriment of our patients. I started long ago trying to work past that, trying to think more holistically, comprehensively, so that we're not just throwing pills at every problem, that we maybe want to get to the root of the problem and have people be healthy or well instead of just controlled with pills. Doctors are kind of generally forced into this, here's the problem, here's the pill box. There's a variety of factors. It usually does come down to time and money. The average doctor gets about 15 minutes per patient, which is not very much when you have to think about what happens. We have to find out why the patient's there, and that may be harder than you think. Not everyone comes in with telling me exactly what's wrong. Sometimes we're well into the visit before we get to the actual issue. You have to take a history of when did the problem start, what makes it better, what makes it worse, trying to figure out where did this come from. Is there a family history? Are there societal triggers or factors? There's a long list of things you have to think about. You have to do the exam to try to help confirm the diagnosis. You actually have to tell the patient what the diagnosis is, why you think they've got it, and what we're going to do to make it better. You have to talk about medicines if you prescribe them, what are the potential side effects of medicines. And then at the end, you have to sit down and type up a note documenting everything. And a person like me, two-finger typer, takes forever. So doctors tend to run behind. Add to that the fact that it's very common for patients to come in and complain of like anywhere from 2, 3, 4, 5 problems per visit. My record is, I think, was 14 problems with one patient with one visit, and it keeps being, well, while I'm here, I wanted to also mention this, elbow problem or this back problem. Fine to do that, but the problem is often we get told about these extra problems at the end of the visit when we think it's over, and then we have a whole new visit ahead of us. So in effect, then, doctors don't have enough time to take care of the problems that they're needing to address. So we tend to throw a pill at it. Here, take this, call me if you're not better. Many people love that strategy. It doesn't ask much of the patient. The patient gets this here, take the pill and nothing else changes. And a lot of people don't want to make a change. They like doing exactly what they're doing. People are creatures of habit. I am too. And so throwing a pill at a problem doesn't ask much of the patient. In fact, I've had some doctors tell me, shut up, doc, and just give me the pill. Used for an example, a person could come in to the doctor's office and say, doctor, I have a headache. I could prescribe an anti-inflammatory medicine. I could send them to physical therapy. We could put a pad on the top of their head, but we're not going to get the person better until we stop the reflex hammer hitting the head. So I like to get more to the root of the issue. High blood pressure is a good example. Of course, a good part of high blood pressure is going to be genetically driven, but it goes beyond genetics, of course. Many people have bad habits. They might smoke, they might drink to excess, they might take way too much coffee. Notorious in this modern society would be a diet loaded with salt. I had a gentleman earlier today with high blood pressure, and he had a pastrami sandwich for lunch, just standing room only salt. Sedentary lifestyle, not getting aerobic exercise, various things that I could go on and on that play a role. Also nutritional deficiencies, not enough of the omega-3 fatty acids, not enough magnesium, calcium, or vitamin B3 in the diet. Various things that make a difference. So I can throw a blood pressure pill at someone, but I want them to work on natural, holistic things. If they're overweight, lose weight. If they're not exercising, start doing aerobic exercise. But the long-term goal is to get their blood pressure normal without medicines. You can look at, like, I hate to pointed out, but my own dad, for example, he's very proud of his normal blood pressure, but he's on 3 blood pressure pills to get him there. I try to push him to suggest that having normal blood pressure, having a normal blood pressure without needing the medicine to get there is even healthier still. But in order to do that, you have to make a change. He has to start exercising, and he doesn't want to. He'd have to cut out the salt in his diet, but he doesn't want to. So really, a good many people who are not particularly interested in doing healthy things, about changing their lifestyle, then my video series are not going to be for you. For the people who want to make a change, who want wellness, then I'm your man. Okay. What happened is, going back to med school, I was taught that patients remember about 1/3 of what they're told in the doctor's office. They showed us a video where the doctor was on a script. He said exactly what the diagnosis was, exactly what the medicine was, exactly what the side effects of the medicine were. Then the person walked out and was immediately quizzed by a person with a little clipboard of set questions. What was your diagnosis? What was the medicine? What were the side effects? And the answer was usually, I don't know, he didn't say, I don't know, she didn't say, etc. Pretty shocking. So then I got in the habit of, for each visit, I would write down what the diagnosis was, and I was writing out a sketch on it using pen and paper about what the plan would be in addition to whatever medicine. And then what I found was, well, golly, if I writing it longhand every visit, why don't I just type it up? And then they can come in and I can print out the information sheet. And then what happened is, over the years, with 22 years of doing this, I started making my patient education handouts longer and longer and longer. So my high blood pressure handout goes on for like 8 pages. So it became more elaborate. And then I started thinking, well, during my office visits, I often give the same kind of lecture. So a person comes in with back pain. I pretty much say the same thing over and over and over. And I thought, well, golly, what if I just videotaped this? What if I took my lectures for each common medical problem, videotaped them, and posted them on the internet? Not only then could I have my patients, if they want to review the lecture, because people often like video over written, okay? So then the patients would get a video link to go watch the video where I talked about the various medical problems and my take on how to treat them. And they'd have my written handout as well. And so that's the genesis of these videos. This is the first video here to introduce myself and my way of thinking. Subsequent videos will be more to talking about medical problems and more precisely holistic things the average person can do for their medical problem. So ultimately, to get a change, a person has to make a change. More of the same pretty much gets more of the same. So I'm here to be an agent of change. A little background on me, if you wanted to know. I went to the University of North Carolina at Chapel Hill. I went there undergraduate. I liked it so much I went there as med school as well. I took a little time off between undergrad and med school, and I was a ski bum out west. Woohoo, snowbird. So decent education, graduated, went to University of Utah Family Practice Residency, again because I'm a skier and left it out there. Ultimately, I've moved back east now. Currently, right now, I'm in Nantucket doing a job through a temp agency. I'm looking to set down roots, don't know where that'll be just yet, but I'm working on it. So what I'll be doing is posting my patient education videos maybe about 1 week or so, give or take, depending how busy I am and other factors. On YouTube, I'll be posting ideally at the same time a patient education handout corresponding to the video on a blog or website I haven't created yet. Ideally then people can get the video, they can download the patient education info sheet. Now my goal is wellness. My goal is that these videos and my patient education handouts become widely circulated. I'm not looking for fame and fortune here. I never want to become one of the sellout docs that promise miracle cures and advertise to you all sorts of gimmicks. Wellness isn't usually about some miracle cure gimmick. Wellness is usually about hard work, okay, and good habits. I think the 5 fundamentals of good health are good sleep, good exercise, good nutrition, Avoiding toxins, which can be too many doctor-prescribed pills even. One of my mottos in practicing medicine is FTD, which stands for first think drugs, first blame medications if someone comes in with saying they're upset stomach or headache or what have you. But also too much alcohol, caffeine, tobacco, the kind of street type elements that kind of mess us up. And then number 5 would be stress, and stress isn't necessarily what happens to us, but how do we react to what happens to us. If there's number 6, I'd say choose your parents well. Apples don't fall far from the tree, and so of course we tend to inherit mom and dad's problems. Also, we tend to mimic mom and dad's bad behaviors. Ultimately, I am not your primary care doctor. Your primary care doctor knows you best. My advice that I'll be giving in these videos is not a substitute for what your doctor wants you to do, but maybe could be done in addition to what your doctor wants you to do. Your doctor knows you ideally and can give you specific advice. If anything I say conflicts with what your doctor says, go with your doctor, okay? Ultimately though, maybe you might get a few ideas and talk to your doctor about some of the things that I'm saying in my patient education videos. Anyway, hopefully this catches on and helps spread the word. If you find my videos interesting or educational, you can tell other people about them. Print and share my patient education info sheets, and I'd be flattered and honored. In the long run, I think people boil down to thirds. About a third of the people will take my advice and really change their life, and we get them well, and it makes a big difference. For those people, when they're in my exam room with me here, I give them high fives and hugs, and tears are shed. About a third of the people will change some of the things in their life. They'll get a little bit healthier, maybe we'll trim the pill list a little bit, and that's also a success. And about a third of the people just really are resistant to change. And for those people, that's fine. We've got mountains of pills to prescribe. One way or another, we tend to get something under control. Okay. I'll be talking to you guys soon. I have another lecture I'd like to do. This one getting more. The next one in the series will not be talking about a medical topic in particular, but just an experience I had during med school, which kind of really influenced significantly who I am and how I practice medicine. So we have a fun adventure story as the next video, and then we'll get down to business. All right, thanks for listening. Have a good day. Bye-bye.